a new baby.
I'm sorry,
So-
Michelle. I forgot to press record.
Oh, sure.
You all, I'm
So,
recording this.
um, basically, there are two sex cells, a sperm or an egg. Males produce sperm, females produce eggs. Sex is binary. It's that simple. Um, how is sex determined? It's determined by sex determining genes. It's determined by genetics right at fertilization. And as long as there are no birth defects, no genetic disorders, at fertilization, every female will contain two X chromosomes with sex determining genes, and every male embryo at fertilization is going to contain an X and a Y chromosome with those sex determining genes in every cell of the body with a nucleus. Now, drugs and surgeries cannot do a thing to our genetics, and that is why sex cannot be changed. So no drug or surgical procedure can change sex. Those are the facts that are being denied. Well, what about intersex? What about intersex conditions? Don't they prove that sex is a spectrum? This, of course, is what the transgender activists use and throw out. And really, the transgender activists are um, exploiting people who, in fact, have genetic disorders. People who are male or female, but have disorders that affect their sex development. So these are birth defects that actually impair a person's fertility. Thankfully, they are very rare. 0.02% of the population, or 2 out of 10,000 births, will there be an infant with genitalia that are ambiguous. Um, these infants, however, can undergo further medical testing to reveal whether they are male or female. Or there's another group of individuals with disorders of sex development who don't come to a physician's attention until later in life when it's discovered that their chromosomes and their sex genes do not match their the outward appearance of their body. Um, what the transgender activists conveniently have denied and try to have us forget is that since the 1960s, psychologists have understood that gender identity, simply defined as recognizing, am I male or female? We've known that this is a cognitive process that develops in typically the first 7 years of life. Um, Lawrence Kohlberg and Jean Piaget were the two psychologists who first discovered how this unfolds. Typically by age 3, a child can correctly identify whether he or she is a boy or a girl. It's not until later, usually by age 5, that children understand boys grow into men and girls grow into women. And even then, even at age 5, they still have this element of magical thinking. So they may believe, these young kindergarten children, nursery school children may believe that if a man puts on a dress, he has just changed his sex. They don't understand permanency. That usually comes in at age 7. Now they will understand, oh, of course, boys grow into men. It doesn't matter how you dress, a man in a dress is still a man. We also, in the psychiatric literature, there are 16 studies that acknowledge that atypical gender identities can align with biological sex during childhood, teen years, and adulthood, both with and without counseling. And typically, these were, if it was with counseling, it could have been individual. um, or group counseling. So, what have we been thrust into, say, since 2007 when we had the first pediatric gender clinic open at Boston Children's Hospital? Since 2007, we have been fed at every level, both not just in medical schools, sadly, but everywhere throughout social media, the educational institutions from preschool forward. We're being told that children are born, some children are born transgender, and that they must be affirmed at every age, even as young as 18 months. And following this social transition, meaning we affirm them by allowing them to uh, change their names, change their pronouns, their dress style, etc., um, in order to prevent them from becoming anxious around puberty when their bodies are going to declare their true sex. Well, we must put them on puberty blockers. And that can happen as early as age 8. And then we must put them into the correct puberty, right? Their trans puberty, by putting them on cross-sex hormones. This means by putting boys on estrogen and girls on testosterone. And finally, um, you know, prior to 2007, cross-sex surgeries would not be considered until you were 18 and older. Uh, but for years now, we have examples of even some girls as young as 12 having double mastectomies on their healthy breasts because uh, they are trans identified. So this is what we're facing. Uh, the most of the there are many so-called studies. They are not the high quality systematic reviews, but there are many biased reports claiming that social transition is harmless. Two of the most common I have on the screen from 2016 and 2017, they've been referenced most repeatedly. A Dr. Walter Schrum reviewed those studies, and he is a statistician as well as a sociologist. And he was struck to his scientific mind, he believed there had to be some calculations and data missing. So he contacted Dr. Christina Olson and Dr. Durwood and asked if they would kindly share their data set. They used a single data set for both papers, and they were happy to share it with him. And he recalculated the statistics and found once they provided the data, their full data set. So indeed, they had withheld some data from the papers. So including the missing data and correcting for statistical errors, he found that the children who were affirmed in their false identity actually had lower self-worth, and that lower self-worth tend to worsen the longer they were affirmed. We also have at least 5 studies now to show that when we socially affirm kids and put them on puberty suppression, it's essentially a self-fulfilling prophecy to the kids continuing to identify as transgender and requesting cross-sex hormones. Um, Prior to our social propaganda and the medical abuse of children, um, up to 88% of gender confused girls and up to 98% of gender dysphoric boys would resolve their gender dysphoria by young adulthood. So up to 88% of young girls and up to 98% of young boys who were gender confused, if they were accompanied, affirmed it, in their self-worth for the type a boy or girl who they were, affirmed despite breaking sex stereotypes, the vast majority would embrace their physical bodies by young adulthood. And approximately two-thirds would they would no longer identify as trans. They would about two-thirds would identify as same-sex attracted. But the bottom line is that prior to our propaganda and medical abuse, most kids got better before or after natural puberty. So to understand why talk therapy is so important for gender questioning youth or gender confused youth, we also need to understand the side effects, the harmful side effects of medical treatment. Puberty blocking, by definition, puberty is not a disease. Puberty is a critical developmental stage for physical, emotional, and social and cognitive growth. So blocking normally timed puberty is harmful by definition. On top of that, base harm, because we're causing disease. The absence of normal puberty is a disease. So on top of that, Lupron, the blocking agent itself, has the following harms. Right on the box, right on the insert, Lupron warns prescribers, monitor your patients for new psychiatric disease or worsening of psychiatric symptoms during treatment. Why? Because, again, right on the package insert, Lupron can cause labile emotions, so anxiety, depression. Why? So, why would any doctor recommend a medication that can cause psychiatric illness, that can cause labile emotions for children who are already, the vast majority, struggling with anxiety and depression? It doesn't make sense. Lupron does prevent secondary sex characteristics, so it does present that sexualization. It also slows bone growth and decreases bone mass. So this means that the children with gender dysphoria who are put on puberty blockers, if they are, and they could be on those blockers from age 8 to 21, they will not achieve their normal height or their normal bone mass, and they will be at risk for osteoporosis and bone fractures as young adults, not as, like in much older years, past menopause for females, for example. We're also with Lupron preventing the normal organization and development of the brain. And there is at least one case study of a little boy who was on blockers for a period of time um, and had a dramatic drop in his IQ. That's just one case study. There needs to be more studies to determine is that true of all children. But I would argue we don't need those further studies. Again, we know what happens during normal puberty, and we should be able to logically reason stopping normal puberty, preventing the normal development of the brain is a bad thing. We also know Lupron is FDA approved to treat prostate cancer in men and endometriosis in grown women. When these men and women use Lupron to treat their disease, they suffer a decrease in their memory. So we should not be giving this to healthy children. Um, Also very significant, when these children are put on the Lupron, it stops their eggs if they're girls, and it stops sperm in boys from developing. If they, while, now being on the blocker, are then put on cross-sex hormones, probably over a matter of a few months. Once you're on that together, within a few months, the ovaries and testes can be permanently sterilized. And even beyond, so there's your sterilization. We're sterilizing children. This is, there was a time when that would be recognized as eugenics. You're taking emotionally troubled youth and you're putting them on a medical regimen that's going to prevent them from having children. There's a one time not too long ago when every physician would recognize that's unethical and eugenics. Even beyond the fertility, um, as these children come to young adulthood, uh, they're not able to even have normal sexual function. What are the risks of cross-sex hormones? So the risks from oral estrogen to males, blood clots, strokes, heart attacks, diabetes, cancers, as well as emotional psychological distress. And these young people are basically turned into medical patients for life. If they want to maintain, if they are male and want to maintain a feminine appearance, they will need to be on this toxic medication, this estrogen for life. Similarly, females would need to be on testosterone for life, and similar risks for the females as for the males, heart attacks, diabetes, liver disease, sleep apnea, cancers, emotional and psychological distress. So, what is the proper way of understanding gender dysphoria, which we don't have to look too far in the past, prior to 2013. 2013 is when the fifth edition of the Diagnostic and Statistical Manual for Mental Illnesses was published. In that fifth edition, gender identity disorder was no longer called gender identity disorder, it was changed to gender dysphoria. And there was this push for affirming the false identity. Prior to that, gender identity disorder was seen in a similar category to other um, mental illnesses such as anorexia nervosa, body dysmorphic disorder, and body integrity identity disorder. These are similar because they all involve a person's conception of their bodies, right? I mean, most of us are very familiar with anorexia nervosa, in which an emaciated, very dangerously thin individual sees themselves and feels as though they are obese. Body dysmorphic disorder tends to involve a female or a male who is convinced that they are ugly or seriously scarred, usually on their face or another part of their body. Body integrity identity disorder, these are individuals who are convinced that they are actually disabled. Many of them are convinced that they are amputees trapped in an abled body. And their emotional and mental discomfort is so significant, they will seek out surgeons to either remove limbs or perhaps sever their spine to leave them unable to walk, for example. Others believe that they are actually blind, even though they can see, and they will try to blind themselves. So these are very tragic and traumatic illnesses that deserve the best treatment so that these individuals can live a fulfilling and flourishing life with in reality. And that can only come from psychotherapy, not from mutilating surgeries. Some of the common contributing psychological factors to our youth who are struggling with gender identity, uh, sometimes there are reactive attachment disorders in early childhood with the primary parent or the primary guardians. Certainly adverse childhood events, and that could be verbal abuse, physical abuse, sexual abuse. It could simply be bullying, even at school, and the abuse could be within the family, outside the family. It leads to the trauma, which gives the child a false belief, perhaps the belief that um, I'm not safe in my body. I'm not safe as a girl. I'm not safe as a boy. Um, Another common theme that can be discovered in therapy is the theme of I'm not loved in this body. I'm not loved as a girl. I'm not loved as a boy. Um, Other common coexisting conditions, children with autism or teens with, and even young adults with autism are prone to struggling with gender identity, as well as those with ADHD. Pornography addiction is a common co-occurring addiction, primarily because it can lead to sort of this OCD, this ruminating about your body and your gender, as well as underlying major depression, generalized anxiety, social anxiety, and less common in younger kids, but still found among some teens and more common among older adults is autogynephilia, which is a sexual fetish. In 2018, there was a very large and powerful study conducted by Kaiser Permanente, which identified um, that among trans identifying teens, adolescents, psychological disorders, hospitalizations, self-harm, and even suicidal ideation all came before they ever identified as trans. And this is dramatic because there are multiple studies to document that among our trans identifying teens and youth, that there's significant either neurodevelopmental differences like autism or significant traumas. There was another study that found those who identified as trans had a history on average of 5 traumas during childhood. So now that we have, at least 2 studies demonstrating that these psychological disorders or neurologic conditions or traumas occur first, it allows us to conclude, with more certainty that, gender dysphoria, gender confusion, gender questioning, it's not something you're born with. It's actually a reaction or a response to traumas and psychosocial factors. And also very recently, this was February of 2024 in the British Medical Journal of Mental Health, a large study out of Finland found that it was the comorbidities, that means underlying psychological issues, the underlying psychological issues, not the gender dysphoria, not the trans identification, the underlying issues predicted whether or not there was a death by suicide. So again, this was a very powerful study uh, because it completely eliminates or squashes the that line that is used to emotionally blackmail so many parents. Well, do you want a, dead daughter or a live son? Complete emotional blackmail. Uh, and Dr. Michael Biggs out of the UK looking at data from the UK, pointed out at least 2 years before that Finland study that being trans-identified seemed to increase your risk the same amount as anorexia or depression or autism. And he pointed out, anorexia, depression, autism, they all coincide with gender dysphoria. So we can't, and his point then was we can't really say that being trans-identified by itself increases your risk of suicide. It may be due to the underlying causes and more, and also very importantly, he said, of course, we are concerned. We're concerned about all young people who threaten suicide. But so let's remember a trans-identified youth, yes, they have a higher rate of suicide, but it's the same elevation as any other youth who's at a greater risk. Whereas the activists for so-called trans rights would have us believe that, oh my goodness, eons above anyone else. You've got trans-identified individuals who are killing themselves most of all. We need to be most concerned about them. Don't think of anyone else. No, they're right here at an elevation the same as all other at-risk youth. And now we know why. So just as we see with other mental illnesses or really any human behavior, it's psychosocial factors that shape us the most in combination, right? Our environment in combination with our DNA. I mean, we're made of DNA, so we have a certain vulnerability, certain personality traits shaped by our DNA. So our DNA matters, but there's no behavior, there's no way of thinking or identity that is determined by genes alone. It's our biology plus environment plus choices we make. In the case of trans identification, for example, a child who chooses to take part in a school gay straight alliance club is going to be at higher risk of trans identification than a child who does not go to that club, for example. So it's not that children actively choose, they don't just wake up one day and say, hey, I'm going to identify as trans. It's it's an indoctrination, a social contagion on top of these various vulnerabilities and or neurologic um, conditions like ADHD or autism and or traumas in their life. So it all contributes. And to now we're going to talk about a few more sort of psychological concepts. There's the concept of primacy effect that people firmly believe and remember the first, or they're more likely to firmly believe and remember the first thing they see or hear about a subject. And this is one of the reasons drag queen story hours are so harmful to young children, right? And it's also why activists, they know about this. It's an effect that's used in marketing and advertising, of course. The other reason it's a double whammy for our young children is, and I alluded to this earlier, our young children between the ages of 2 and 7 have this magical thinking. Developmental psychologist Jean Piaget, he outlined this again in the 1960s. These young children engage in magical thinking because they haven't developed the ability to think logically about cause and effect. They will attribute events that happen around them as being caused by their own thoughts and or changes in external features. So a 2 or 3-year-old who thinks, I hate David, my brother, my brother Dave, I hate him. And then David falls and breaks a leg. Um, that sibling might believe, I thought I said I hated him. I thought I hated him. And oh, I made him break his leg. This magical thinking. Um, Similarly with gender, if dad puts on a dress, oh, he's suddenly become a girl. So with that developmental immaturity, you expose your preschool children to drag queen story hours. This I've called that psychological child abuse. It's you're derailing their reality testing, their normal development. When we have children with autism, they think very much in, they're already uncomfortable from various sensory inputs. They're struggling socially. They tend to think in black and white absolutes. And so if they are exposed to any sort of gender bending storybooks, drag queen shows, etc., they're much more vulnerable to those sorts of manipulation. Um, and as they get toward puberty, I've never met a single child, I don't, or adult for that matter, who really felt great about puberty and just loved the whole experience, right? It's normal to feel uncomfortable going through puberty. Um, but that's not what the activists tell our children. And if you're autistic, you are going to be more likely to believe, oh, I guess I really, really admire this person in you know, um, the Alliance, the Gay Straight Alliance Club, and oh, they're so cool. And this is where I have all my friends, and they're telling me that I'm miserable because I'm trapped in the wrong body. Well, they're going to believe that more readily than another child. Eric Erickson, I want to focus on him to get an even better idea of why all teens are very vulnerable to the transgender messaging. If you look at the purple step, the stick figure is stepping onto the purple step. Identity versus role confusion, that is the entire job of a teenager. So that stage of development, the entire role of being an adolescent between 12 and 21, although it's now been expanded. I don't consider a 10-year-old to be an adolescent. To me, a 10-year-old is still a child, but the World Health Organization has expanded adolescence from as young as 10 to the age of 24. Nevertheless, during adolescence and the teen years, our youth are trying to figure out who they really are. You know, what values will they embrace? They're going to differentiate from their parents, grow in independence. If they succeed, they will have a solid identity. Um, if they stumble, they're left with this role confusion. So this is their job. So if they are suddenly love bombed by these transgender activists, um, they're going to be very prone to that. They want to be liked. They want to be accepted. And that's where they're going to go to define themselves. And the activists realize this. They realize that teens are very susceptible to love bombing. And it's a cult tactic. It's an advertising tactic. And it does go, it most certainly does go toward explaining how in less than 10 years, there was a 5,000% increase in young girls identifying as trans. And in this slide on the x-axis is showing from 1976 to 2013. And the light gray line, the light gray jagged line, those are girls presenting to a gender identity clinic in Canada and the Netherlands. The dark gray line are boys. And what you see is that it was extremely low and relatively stable until the launch of Facebook, which is the blue vertical line. Then we had a spike. Um, we had, and the boys kind of drifted down again, but when Tumblr was launched, that's the vertical green line, there was a greater spike among the girls. And Instagram launches in 2010, and we go off the charts. Um, this pattern is similar to what we see in eating disorders in the sense that girls seem to be, or females seem to be more impacted by visual inputs, social, whether it's TV, social media. Uh, Boys are impacted as well, but to a lesser degree, and we don't really know why. But this is demonstrating the capacity, how much influence we can have with through social contagion. So in this, in our current culture, in which this transgender activism, it's very politicized. And although, we've just had a change in administration, and it's been a complete 180. We came out of the Biden administration, which was 110% top down enforcing transgender ideology onto physicians, all healthcare workers, within the education structure and families to um, the current administration, which is reversing that. Well, people don't, people don't change. They don't turn on a dime. They don't change their thinking overnight. So when it comes to being therapists, and there are therapists who want to do the best for children, who understand that um, children are not born innately gender confused. They have to be very careful about how they go about it because there are 28 states in the United States that have outlawed what's called gender identity change efforts as conversion therapy. So, this particular article by a Dr. Stephen Levine, Reflections on the Clinician's Role with Individuals Who Identify as Trans. Um, he's one of the good guys. He initially, what's remarkable about him is that he was initially on the very pro-trans side of this in the beginning. And when he realized the harms that would come of the medical model and that it wasn't reversible, um, he said, you know what? Here's what we should be doing. We should be doing at least five things, getting five things across to the children and families. Number one, we want to either maintain the family bond or reestablish it. Number two, we want to help young people understand that parents are not their enemy when they express concerns about their child's future. Number three will sound scary. Um, he also said in his practice, we state from the beginning that the adolescent is in charge of determining his or her gender identity now and in the future. Why why would he why do that? A couple reasons. Certainly when you're dealing with adults, if an adult, whether they're a functional alcoholic or um, dealing with a similar behavior issue that maybe family wants them to address more than the individual wants to address, uh, you can get buy-in by saying, look, we can't force you to do anything. However, would you at least consider exploring um, an alternative that may help you be even healthier, right? So there's that aspect. a teenager, if you're in most situations, the teen and the parents are going to be head to head and in conflict. So he wants to diffuse that conflict and say, you know what, let's come together, let's work together. You know what, Mr. Ms. Teenager, we can't get inside of you and make you do anything. Ultimately, you're going to be in charge. But this is going to be a journey. We're going to explore, we're going to work on, are there issues besides the gender identity? Are there issues besides this that we can help you with so that you can be as healthy as possible and make the most informed decisions possible? I mean, that should be something that everyone can buy into. Um, and which leads into his number four. He he wants them to understand it's super important to identify and discuss factors that moved the teen to this non-traditional identity. Um, and he and his team work to help the teenagers understand that everyone always has some ambivalence about major life changes, even though most of us would deny it. There's always some ambivalence there, and that's okay, but let's work through it together. This format is what actually buys young people time, buys them time to mature, time to explore, as opposed to the puberty blockers. Puberty blockers are not a pause button. The HHS report, which was just issued by the Trump administration, accurately identifies puberty blockers as an accelerator, a gas pedal. Um, so Dr. Levine, who does also advise other therapists who counsel gender questioning youth, points out that you have to start with a thorough medical, developmental, and psychological history and exam. At least two visits. You need a joint family session as well as a session alone with the teenager. Use character affirming communication, right? Positive talk, not negative talk. Focus on positive character traits. Focus on differentiating between sex stereotypes and even though, a girl who loves sports and uh, typical masculine things, you're still a female and you're an amazing female. You're a strong female. Um, Number three, um, whenever we're dealing with depression or anxiety, a physical exam, psychological testing, and basic blood work should be done. Sometimes there are medical conditions such as a severe anemia, a vitamin D deficiency, or hypothyroidism. Those three are associated with depression. Obviously, drug screens and other things also may be needed to be ordered. And then once the full evaluation is done in at least two sessions, there will be a third visit with both parents and child to discuss the findings and recommendations. What are some forms of psychotherapy that are effective in treating depression, trauma, anxiety? Psychodynamic, family, or interpersonal talk therapies, um, cognitive, dialectical behavioral therapy. Some may recognize, so cognitive behavioral therapy is abbreviated CBT, and dialectical behavior therapy, DBT. Eye movement desensitization and reprocessing is a form of talk therapy that is geared and especially healing for traumas, so for PTSD. And various studies, you could have up to 70% success in either completely relieving or at least significantly improving depression, anxiety, and trauma responses. So these talk therapies are longstanding therapies in the arsenal of counselors and psychiatrists for many years. We're confident in their ability to help those underlying issues. And so we should have some confidence that, yes, these can help buy time for our youth who are struggling with gender identity. In this slide, I've highlighted one booklet by Restore Childhood, which is relatively new. It is available from their website, which is going to be in the next slide. Um, the Restore Childhood, How to Guide Your Child Beyond Gender Identity is wonderful because it's only 10 pages long and it's very simple. It's not going to give you a step-by-step guide, but it covers basic concepts that parents can work with and integrate into their interactions with their own children. And the author is a young woman who she detransitioned in her 20s, her mid 20s. I think she's around 28 now. And Maya Poet is her name. So that can be downloaded from restorechildhood.com. The second book I want to highlight is available on the Advocates Protecting Children's website, Common Sense Care, Parenting Gender Confused Kids with Truth and Love by our own Erin Brewer and Maria Keffler. Now, this book actually includes transcripts to 35 videos. The, the videos are free and available on the Advocates Protecting Children's website. Each video is roughly 20 to 30 minutes long, and it tackles a particular topic or conversation that parents can have with their children. And many of our patrons along the way asked if they could have a transcript to go along with the videos. So the videos are free. The transcripts, Erin Brewer, Dr. Brewer, and Maria Keffler put together in a book. And so the book with the transcripts is available for purchase. And finally, Maria Keffler's Desist, Detrans, and Detox, Getting Your Child Out of the Gender Cult. I do highly recommend that as well. And again, there's no one size fits all for each, for multiple families, there's no one size fits all. But with the Common Sense Care and the Desist, Detrans, Detox, you can get examples for various situations and ways to tweak it for different personalities. The Restore Childhood Guide, that is your nice, quick, easy to read, quick and dirty 10-page. So it's you may want more than one. Where can you go for more resources as well and ultimately to find therapists? So for resources for parents, advocatesprotectingchildren.org, restorechildhood.com, I have in yellow because it's the only .com. Therapyfirst.org. Therapyfirst.org is exclusively for therapists, psychologists, and psychiatrists, or I should say it's an organization of mental health professionals, and they have a parents page, and you can also request therapists there. Biologicalintegrity.org has a parents tab, including a link to where to request a therapist. Now, generally, when you go to these links for requesting a therapist, you will be taken to other links, not for specific names of therapists, but for other organizations. So therapyfirst.org, these tend to be mental health professionals who are left of center, and other organizations, for example, they're at biologicalintegrity.org includes a link to my Catholic therapist, and some Christian sources, as well as secular. And that's so I just wanted to give an overview. I wanted to give the rationale for um, why we should feel hopeful that yes, as scary as this is, empowering parents to parent their children and helping them find a therapist actually can work to guide our guide our gender confused youth through puberty and into embracing their healthy bodies.
Thank you, Dr. Cretella. I want to invite anybody to either post their questions in the chat, or if you feel comfortable and you'd prefer, if you want to unmute yourself, you have that ability here to ask any questions that you might have for Dr. Cretella. In the meantime, I have a question, Michelle. So, are there any statistics with regard to the watchful waiting? What used to be the practice in watchful waiting? That way, is it, are there more successes in ultimate desisting with their therapy versus without therapy?
That's it's really interesting. You would have thought they didn't do those studies. Um, yeah, even prior to the transgender push into pediatrics, the studies really only looked at desistance, and they would lump watchful waiting with counseling and watchful waiting without counseling was never, it wouldn't be identified. They just lumped the two together as
Really
watchful waiting. Um, mm.
interesting, because in the world of, is this therapist trustworthy, really? And then you're turning your child over with some, you know, eh, concern that you're not going to get true feedback and you're not going to be able to participate in the room. Um, do you choose therapy versus, truly let's hold back on that and prevent the labeling of that child? You are now being labeled by the psychological community as gender dysphoric, versus let's just hold back here and see how this
Well,
goes.
so in fact, yeah, I'm glad you asked. I'm glad you asked it that way. What could be done is that virtually every child who is struggling with their gender identity virtually everyone has anxiety and depression underneath. Now, they are being told that their anxiety and depression is because they're trapped in they're being told by the activists or their peer group, well, you're trapped in the wrong body. That's why you're depressed and anxious. However, if you, for example, therapyfirst.org includes only mental health professionals who believe that medical transition is harmful. So they are going to do their darn best to help that child heal from those underlying conditions. And you, um, so if you express a concern, listen, I'm not, as the parent, and particularly if, the child's a minor, you can, you have a right to be present. The child's a minor, under 18. You have a right to be present in the room um, for as many of those therapy visits as you want to be in. Now, because of the developmental stage, yes, the child should be alone with the counselor at times too. But up front, the two should be together. And you can have the discussion with your child and the therapist and say, perhaps it's best, could we simply have, the we're here. I would like us to be here to treat depression, anxiety, and I even tell the counselors who are practicing in states where gender identity change is outlawed anyway. I tell them, I say, look, and it's not a lie. I said, tell the family and the child up front, I'm not here to change your gender identity. I am here to treat any mental illnesses that we can identify that because I want you to be as healthy as possible. Um, the focus, I mean, yes, we do need to, yeah, of course, I'm going to ask you questions about your gender identity because I need to know who you are and what you're about and where you came from. But um, you almost don't want the gender identity to be the focus. You
Right,
really want the
right,
focus to be healing, getting the child to open up and identifying if there were traumas, bullying, etc., and healing the bullying and the traumas.
right.
And so it can work. It is definitely delicate.
Yeah.
Um,
We have a
but
question
you,
in
yeah.
or a comment in from Heather in the chat. I
Hmm.
brought my daughter to a therapist who, in my opinion, affirmed her transgender in air quotes. And I don't know how to undo that therapy, and I'm being judged by the therapist for not supporting her.
Yeah, that's the word. I know okay. If the ch when that is a horrible position to be in. If if your daughter if your if your daughter is under 18, you can switch therapists. Um, I mean, you have a right to switch therapists. And I don't know how sophisticated your daughter is, but I mean, this is a suggestion. You are the expert on your own daughter, so I can't give you direct advice. But some families, I mean, you're certainly not alone. Some families simply told their daughter, "Oh, you know what? Insurance uh, so and so is no longer uh, covered by our insurance. We have to switch, and we're going to XYZ, Doctor so and so." Um, and just didn't allow, and that was it. Just cut it off. Because as long as you have a therapist who's affirming your child is transgender, um, you're right. You're not, you're going to
Right.
be seen as the enemy.
Right. And that's tricky because your child may very possibly have bonded with this therapist to the
Mhm.
and making it really a difficult relationship to extract from. Um, I want to add something, Michelle, if you don't mind,
No, no,
to that
absolutely.
comment. That I would really encourage you, if you haven't read yet, Desist, Detrans, and Detox, Maria's book about really, truly viewing this issue as a cult and how does a parent extract their child from the cult and the many techniques that she talks about in there are really valuable to consider, and they're not easy and they're not fun as a parent to implement because you know your kid doesn't want to hear them. And what Michelle is suggesting, although it sounds drastic for your child who may or may not have, but likely has bonded with this therapist to take drastic measures. Yeah, it's that those are the tough decisions that the
Yeah.
adults in the room have to make to
Right. And I think what I would do,
You get their kid from the cult.
right, and I think what I would do first is go to biologicalintegrity.org and therapyfirst.org and see if you can identify uh, a therapist who is not trans affirming but is reality affirming. Um, I think I would try to identify someone who is, would be on your side, on the side of truly flourishing, truly healing. Find someone good first. And that individual could even, and what I would do is have a conversation with that potential therapist first, just yourself explaining the situation, and they may have um, more specific advice for you, even.
Yeah. We have another question. What is the appeal for girls to become transgender? Hair on the face, etc., and body odor. Question. It's true. Doesn't sound very appealing, does it?
Right. So it's I guess if we're trying to make the analogy with anorexia or how girls become anorexic from images, Hollywood images or so forth, it's not quite that so much as it- we're, you know, our culture has become just so toxic. Um, there are so many things contributing to depression and anxiety, which seem to impact females more than male. I mean, our males are impacted as well, but so it's not that girls are finding the male body sexy and oh, I want to have a male body. It's more they are so depressed and anxious for a whole host of factors that it's damaging. That anxiety and depression is preventing them from being successful in life, and they are being told everywhere, all over social media. Most of them get sucked into um, video after video after video, or various chat groups where there are adult trans activists, and they end up believing the lie that, oh, I feel this way because I'm trapped in the wrong body. If I just make my body right, I'm really a guy. If I can change my body with drugs and surgeries, I'm going to be feeling great. So it's more, yeah,
Right.
it's this whole psychopathology that just builds on itself. You've got this transgender cult, which is literally everywhere in our young people's lives. It's in the public schools, it's on social media, and I can't, social media is huge because once these young people, they click and they click and they click and they just go down these rabbit holes, and it's just video after video of, um, I mean, you may not be aware, but there are just tons and tons of videos of females who've had their healthy breasts removed, and they're showing off their their mastectomy scars. They're like, "Oh, this was awesome. I feel so great now." I mean, you and I would look at these videos and be horrified
Mm.
and think, "Oh my word, these poor girls or young women." But the depressed and anxious teen girl is looking and listening to to these videos as though they're gospel truth. Like, "Oh, look at that. She's just a year or two older than me, and she just had her breasts removed, and she says she's feeling great."
Right.
It's not about logic. It's not about
Mm.
logic. If it
And
were
I
about
just,
logic, it would be real easy to fix. But this is about emotional emotional damage and brainwashing.
I
Brainwash.
just want to add that I think our boys, I mean, we know that this is the time in teens' lives where they're becoming so much more social, right? But
Mm.
the boys at this age, starting in middle school, are so pornified
Yes.
by now. So they're treating the young girls in school very, very objectively and
Yeah.
very, very cruelly.
Yes.
So, as you know, I would say partly as self-protection, and
Mm.
I think that much of it is a response to that phenomenon and being self-protective. That other
Some
girls
of
are
it is, yes.
safer. I don't want to be attractive to these boys,
Yeah.
and I don't want to be
Yeah.
fodder.
Girls and women are weak. They're
Right.
weak,
Yeah.
pathetic,
And
not safe.
the other comment would be Chloe Cole. I've heard her testimony several times where she talks about at that tender age where she was starting puberty. She saw what society held up as the desirable
Ideal.
female body, and hers was not measuring up to that. I will never be able to be that. So I'm a little bit uncomfortable with what I do have. So that must mean, as social media is telling me, it must mean that I'm really a boy.
Mm.
I have another comment here. Um, my daughter ran off with a boy, and he is a girl, I guess. She is a boy, I guess. She cut us off. We haven't spoken to her in over a year. His family took her in. No one talks to us. We are the bad guy. Cut off her sister. What do? We pray every day. We are a close family. I am terrified. All these people are affirming her. I am so sorry. I am so sorry to hear that, Eric. Um, that's yeah. My comment. I'm good. I'll kick it to Michelle after I say this. But we had this situation in my family, not completely cut off, however, and uh, but it looked dire, and we are now on the other side of this successfully. And my daughter has desisted from a lot of, well, entirely, but it looked very grave for many years. And I, I will say, and many people told me this, and I didn't believe it at the time, but it's a marathon, not a sprint. And prayer was the only thing that got me through. So don't give up on praying. So,
Yeah.
Michelle.
Yeah. I wish I wish I had I wish I knew. I wish I knew the silver bullet. Um, there's no guarantee. The only thing that I can think of that comes to mind, I mean, obviously, don't stop praying. And there are two things that come to mind. Number one, if you, I can't remember if you said you know an address where she lives. Um, and if I understand, you could um, tr try periodically sending her, I don't know, maybe send her on her birthday a birthday card. Um, if you celebrate Christmas, Easter, you could try extending olive branches that way. I guess you might want to consider not having your return address on the envelope. Um, and just express your love for her in the note, in the card. Um, and I think I try as best you can to find, if you haven't already, um, maybe to find a couples or family counselor, just so you can get, I mean, what you're going through is so traumatic. You shouldn't be going through it alone. And friends and family, friends, family, a church can be very helpful and positive, of course. No one can fix it. But in addition, um, finding a therapist who can help you take care of yourself through this, you owe yourself that.
Yeah, I would also say that I agree with Michelle entirely. If there are any avenues to maintain or regain any communication, to do that and do it in as loving a way as possible, of course, but also uh, every conversation might not need to be about the gender identity confusion and about the stress that that's caused the entire family and the loss that it's caused for for your daughter's parents. And um, if it, that would help diffuse things, but also not affirming in any way whatsoever. It's my belief that um, the time will come when the marathon ends and many people that desist are looking for a place to land safely, and they need to land at that place that where the person has never lied to them,
Mm.
because the people that are surrounding her now, she knows deep down, are people that are lying to her. And the time will come when she needs to find safe haven in the person that she knows she can trust fully, who's never lied to her.
And you might be, I mean, if even if all you could do were to get a note to her saying we, you are our precious child. We love you. We will always love you and always be here for you. Even if it's just that one simple message. And as much as I hate this word, but you're not writing anything to trigger her, but you're also not lying, as Eileen said. You're not calling her your son. You're not calling her by her made up name. You're telling her that you are our precious, precious child, and we um, love you. We love and miss you immensely. We will always love you and always be here for you.
Right, right,
Yeah.
right. And Eric says that we have, yes, we've sent a few things, praying she's opened it.
Mm,
There is so much shame with being cut off, and it is so divided in this country, and that's so
yeah.
true. That's true.
Yeah.
That's trying to blot out the noise of well-meaning but not well-informed, perhaps, people around you, with the advice to embrace and accept and affirm is not easy.
Mm.
Um, right. Sorry. So, um, unless we have any other questions, I'm going to say we are at 2:17, and we've recorded this. It will be available in a few days on our website. If you'd like to revisit this um, or share it with others, it might help. And take a look at our website. There are a lot of resources available that are available for free it's really a well done website. I take no credit for it whatsoever. I have
No, we
nothing
don't.
to do with it. But people that are much better at that than I am have created a beautiful website. So with a lot of resources available. So um, please know that we're praying for you, all of you that joined us. And anything else, Michelle?
No, I just, again, I very much encourage uh, that our viewers visit these four websites. There are excellent resources there. And sometimes, as parents or grandparents, the best, the very best two things we can do are number one, pray, and number two, um, get help for ourselves just to stay hope filled and have patience. Mm.
Right, right. Well, thank you, Dr. Cretella, for everything that you shared with us today. And thank you all. Have a happy, safe holiday weekend. Okay. So long.
Thank you.
Bye.